COVID-like virus in China. What is HMPV and what are its symptoms? Reports indicate a rapid proliferation of HMPV in China, which manifests symptoms similar to influenza and COVID-19, generating apprehension among health officials. Social media reports allegedly showed that hospitals in China are overwhelmed by a surge in respiratory illnesses, including human metapneumovirus, HMPV. Social media posts claim that outbreaks of multiple viruses, HMPV, influenza A, Mycoplasma pneumoniae, and COVID-19, have led to overcrowded hospitals and cemeteries. Reports indicate a rapid proliferation of HMPV, which manifests symptoms similar to influenza and COVID-19, generating apprehension among health officials. Videos depicted overcrowded hospitals, with unverified assertions of a state of emergency in China. The situation has ignited anxieties of a potential pandemic 5 years after COVID-19 disrupted global life. Nevertheless, these assertions lack substantiation from reliable sources. Neither Chinese health authorities nor the World Health Organization, WHO, have reported a novel pandemic or issued any urgent warnings. Furthermore, the WHO has not declared a health crisis associated with HMPV. All you need to know about HMPV. The American Lung Association identifies human metapneumovirus, HMPV, as a significant contributor to acute respiratory infections. HMPV, discovered in 2001 by researchers in the Netherlands, is typically transmitted through close contact with infected individuals, either via respiratory secretions from coughing or sneezing or by touching contaminated surfaces. In the United States, HMPV circulation is more frequent during the winter and spring months, coinciding with the prevalence of other respiratory infections such as respiratory syncytial virus, RSV, and influenza. Symptoms of human metapneumovirus, HMPV, can vary in severity and commonly include cough, fever, runny or stuffy nose, and sore throat. Some individuals may also experience wheezing and shortness of breath, dyspnea. In certain cases, a rash may also develop as part of the infection. Who does it affect and how? Children, the elderly, and individuals with weakened immune systems are at higher risk of complications from HMPV infection. The virus is transmitted through close contact with an infected individual or by touching contaminated surfaces. HMPV typically causes cold-like symptoms that generally resolve on their own within 2 to 5 days. The majority of HMPV cases affect children aged 5 years or younger. A small percentage, 5 to 16%, of these cases may develop into lower respiratory tract infections, such as pneumonia. Who is at risk? HMPV can lead to both upper and lower respiratory illnesses across all age groups. However, it is particularly prevalent among young children and the elderly, where it is more likely to progress into conditions such as bronchiolitis, bronchitis, or pneumonia. While a history of lung diseases like asthma, chronic obstructive pulmonary disease (COPD), or emphysema does not increase the probability of contracting HMPV, these conditions can exacerbate the severity of symptoms once infected. Similarly, individuals with compromised immune systems, such as those undergoing chemotherapy or recovering from organ transplants, may experience heightened symptom severity if infected with HMPV.